welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Chris Valerian. He's a physician and healthcare executive. He wrote the Kevin MD article, New Strategies Are Needed for Mental Health Treatment. Chris, welcome to the show.
Thank you, Kevin. Appreciate it. Good to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure, happy to, Kevin. Thanks. So Chris Valerian, I'm an ER physician by background, practiced for a little over 20 years, went back early in my career and was fortunate enough to be able to get an MBA so that I could kind of understand what the business people were talking about as I was moving through my career. Was able to sort of see healthcare from several different angles. I was a hospital executive at a variety of C-suite roles at community hospitals all the way up to national chain as well. Then got recruited over to the payer side and worked at the Blues, regional carriers, Cigna as well. And really in that role was where I found my passion around population health and care management interventions around population health, which we can talk about a little bit in the article later. And then finally did a short stint in the private equity world, making healthcare investments and sort of looking at it there. So really had a well-rounded career thus far. Currently, I'm the Chief Medical Officer of Uprise Health, in which I sort of guide all of the clinical development, and we offer integrated behavioral medical services for EAP, which is where the origin of the article came from.
So on the show, we always talk about why physicians need to pursue more leadership positions. Hopefully we can have more physicians say in terms of the decisions healthcare organizations can make. So you have that lens. So through your experience as a healthcare executive, what would you say are some of the ways that physicians can go over to that leadership side or learn some of these leadership skills that they may not have known or learned during training?
Sure, great. It's a great point, and we do need more of us out there, no doubt about it. You know, for me, I was fortunate enough in that I started with sort of committee work. So, you know, I'd recommend starting at your local level, whatever role you're in. If you're a community-based physician on staff at a hospital, or if you're in a large, medical group practice, start asking for participation in, either committees, whether it's quality committees or whatever else is available to you in your local environment. Start to get that exposure, right? Start to get those conversations going. Learn from the people around you, even if there's not other. I'm sure there's some physician executives around there, and it really gives you the opportunity to see that exposure. If you have the opportunity beyond that to get some sort of formal education in the business world, that would be good too. Certainly not required. Like I said, I went for formal master's program. Everyone doesn't have to do that. I think there's several certificate programs out there for physicians in the business world and leadership world that make a lot of sense too. So just again, it's more of a seeking out that understanding for those areas that really we need to act as a bridge and a translator across the healthcare system.
Now, as you reflect on making that transition from your clinical role into the variety of non-clinical roles that you had later in your career, what are some of the obstacles and challenges that you faced, and how did you overcome those?
Sure. So the first thing you have to get over is you are not the king of the castle. So this is not a physician mindset when you're out in the leadership role. You know, your opinion is one of many, usually, especially, depending on the size of the organization. You have to learn how to work well with others, listen to other opinions. You may be an expert in your clinical field, but you are not an expert in that room necessarily. So my advice would be sort of, listen to those around you and be a team player, and really sort of you gotta take that clinical hat off for just a moment and see the world through others' eyes.
All right, let's transition into your Kevin MD article. It's titled, New Strategies Are Needed for Mental Health Treatment. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Sure, absolutely. So as I mentioned, I've had a passion for population health for quite some time, and a sort of subcomponent of that is really the integration between behavioral health and physical health. And I've built programs throughout my career that really integrate the two of those and create interventions that are combined. So the article really the origin of the article is that one thing the pandemic has done is really brought this issue of mental health to the forefront, right? The isolation and everything else that goes around with it. And it's really created a platform to talk about mental health and how mental health and physical health are related, and things we can start to do to intervene. So that's kind of the first part of it. We can talk about why behavioral health and physical health are important. There's tons of data to support that. If you have a chronic illness, for example, you are more likely, 25% to 50% of the people that have chronic illness have a concomitant diagnosed or undiagnosed mental health illness that is probably untreated or submaximally treated. And then the data further goes to support that those patients cost 2 to 3 times more in general in the healthcare system. Again, there's other data to show that treating the behavioral health component alone actually reduces that cost for the physical illness and shows better outcomes clinically for the physical illness as well. Same thing is true on the reverse side as well, although the data is not as clear from a numbers perspective, but the concept is there. So really the basis of the article is sort of bringing the concept of behavioral health to the forefront. It's okay to talk about anxiety and depression and other issues that have been occurring more over the last 18 to 24 months, and then really sort of tying that into physical well-being and finding solutions to manage both of those conditions concomitantly.
So what are the current challenges that face mental health or behavioral health treatment in the primary care setting today?
So, as we all know, primary care, you get what walks in your door, right? And with decreasing reimbursements and just the current state of affairs, it's really hard for primary care physicians to identify behavioral health, mental health conditions and treat them appropriately. So I think one of the challenges is early identification and recognition. Whether primary care physicians implement, just quick screening tools. There's several of them out there that are validated and clinically relevant to kind of at least identify the issues. So if they don't feel comfortable treating them themselves, at least they can make appropriate referrals. I think that's one of the first issues. I think the second issue is really around this siloed approach, right? So you don't want to just refer somebody over to a therapist or a psychiatrist and wash your hands of it and sort of move on. There has to be that bi-directional communication and really develop a treatment plan with your referral provider for the behavioral health conditions, because again, what both of you do in treating that patient is going to impact the other one. And again, like I said, there's plenty of data to show that doing it in a integrated fashion really has better outcomes across the board.
So you mentioned several times about that intersection between physical health and mental health and some of the obstacles that we have in approaching that. So you mentioned some of the solutions, but go into more detail. What are some specific ways that we can address this issue?
Sure. So I think at a global level, if we sort of start top down, right? Yeah. So there's opportunity for carriers, insurance companies, for organizations to sort of approach this from more of a integrated approach, a bundled approach, if you will, a population health approach, and sort of break down some of those silos, whether it's reimbursement silos, whether it's referral silos. So I think, from a systematic perspective, we need to really start to approach this from a more integrated way, collaboratively. Sort of going down into the next layer down around the provider level. Again, I think it really boils down to that bi-directional communication between your referring providers and your referral providers. And again, primary care is a main entry point into the healthcare system a lot of times. So the more comfortable primary care physicians are in managing behavioral health conditions, the better off the patient and the system will be as well. So if there's opportunity for education and expertise around, CMEs, whatever, around treating those conditions, because not everyone has like a formal diagnosed mental health condition, right? I mean, we were just talking about simple anxiety around your family or work life, and that's something that a primary care physician should be able to manage without necessarily a referral out. So I think that's sort of the second leg of this. And then I'd say the third one is really on the employer side. And I've been doing a lot of work with employer groups over the last 18 months, working with them around how to better engage employees in the workplace, because that's where things show up, right? Whether it's disruptive employees or non-productive employees or people that are struggling at work. People talk, I know we're in a virtual world and people are starting to come back more into the office setting now. I've done some writing on that piece of it. Actually, burnout in the in the workers that are coming back into the office setting, or even people that may have lost colleagues during the COVID pandemic, and now they're coming back into the office setting, and that may trigger some emotions and some feelings that affect their productivity. So I think the employers should really sort of at least have a sensitivity to looking for these items, provide services, whether it's traditional EAP services, whether it's counseling services, or at least, again, I work with a lot of HR people, and I tell them, just asking your employees how they're doing, walk the floors. If you have virtual meetings, asking how are people doing, and then sort of look for some initial signs and offer some support there. So I think, sort of it's a combination of sort of a top-down approach and a bottom-up approach to kind of start to break down those silos and start to engage people in the behavioral health, physical health continuum.
So your first point about we need a more integrative approach where we include more behavioral health specialists into the continuum of care. So what are some of the ways that we can break down those silos? Is it simply a matter of funding? Is it a matter of reimbursement? Is it a matter of just hiring more behavioral health specialists? So what exactly needs to be done for more systems to have this integrated approach?
Yeah. So as you know, there's currently a massive shortage of behavioral health providers in this country. I have a national perspective in my current role, and it doesn't matter what state you're in or where you are. There's just not enough supply for demand. So to answer your question on that front, I think more access is the first issue, and whether that means more training programs or recruiting into training programs, I think we need a pipeline. There's no doubt about it. I don't think the demand is going to go away over the next foreseeable future. So that's the first issue. Second issue would be creative alternatives, perhaps, to access to behavioral health providers. Apps. I think I've read one study recently that the number of behavioral health and chronic disease management apps that have popped up since the pandemic started has increased by 50%, 60% over previous. And I think you'll see more and more of those digital engagement tools to try and get people into the system one way or another. And then finally, I think you hit the nail on the head. It is a reimbursement issue as well, right? So it depends on the part of the country you're in. I'm in the Northeast myself, and finding in-network providers is very difficult, and a lot of that has to do with the reimbursement rates and how the reimbursement occurs. There's, if you're willing to pay cash, you can pretty much find what you need, but if you want to stay within your health plan, it's difficult. So I think, again, from a carrier perspective and even maybe a regulatory perspective, I think there has to be some parity around that reimbursement structure as well.
We're talking to Chris Valerian. He is a physician and healthcare executive. He wrote the Kevin MD article, New Strategies Are Needed for Mental Health Treatment. Chris, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Sure, absolutely, Kevin. I think one of them is the awareness that the pandemic has afforded us around behavioral health issues, and just again, a general awareness and the ability to talk to patients about it, talk to colleagues about it, talk to friends and family about it. I think that's one, breaking down those stigmas. The second one is the interdependency between behavioral health and physical health, and how one affects the other. You can't really treat one without treating the other, and just sort of keeping that in mind as people are moving through the healthcare system.
Chris, thank you so much for sharing your time and insight. Thanks again for being on the show.
Absolutely, my pleasure, Kevin.